Go ahead, ma'am.
Good afternoon, everyone. Welcome to today's Facebook Live session. And I'm Dr. Keerthana, Consultant Fertility Specialist at Oasis Fertility, Tolichowki branch, Hyderabad. So today let's discuss about optimization of fertility, which means what can be done from your side to improve your chance of getting pregnant. So this will enable you to have a healthy pregnancy and a healthy baby ultimately. So if we look at the things that have to be optimized, the first and the foremost thing that comes to our mind is what can be done about lifestyle practices. So are we adapting to the right practices to increase the success rate? And the second important factor is what is the age of the female partner and what is the duration of infertility. That means the number of years that got elapsed since the couple is trying to conceive. And if we look at the maximum chance of getting pregnant in a woman, it is in their early 20s and 30s, and within the first 3 to 6 months of trying as such. So that which we call as cycle fecundity rate, that is the chance of success rate. It is around 25 to 30% per month. So with regular unprotected intercourse, penetrative intercourse, and unprotected in the sense without the use of any barrier contraceptives or birth control pills, 85% of the couples, they will be able to conceive within first year of their marriage if everything is in place, and another 10% will be able to do it in the second year. So it is around 90 to 93% of the couples will get pregnant within 2 years of marriage. So the next question that arises is, when should I seek expert help, or when do I need assistance? So if you're someone who is less than 35 and you are not able to conceive within 1 year of regular unprotected intercourse, or if you are above 35 and you are not able to conceive, not able to get pregnant within 6 months, then you will need to get evaluated. So, why this duration is shortened in a woman who crosses her 35? Because as the woman crosses her 35, there will be a decline in her egg quantity and quality, and there will be she will be at more risk to have chromosomal abnormality in the her oocyte. That is why we advise the patient as she crosses 35, even 6 months of regular unprotected intercourse, if she is not able to get pregnant, to seek expert help. So, what happens in a male as he crosses 40 years? There will be a decline in the sperm parameters like the sperm concentration, the motility, and the morphology. But as we all know, age is an unmodifiable factor and it cannot be modified, so nothing much can be done about age. But what are the modifiable factors, or uh, what can be changed to optimize or to improve the chance of fertility? Like, say, we can put it in the other way, like, what are the do's and don'ts that need to be followed? Then about when we talk about the do's, there will be simple changes in the lifestyle and the diet practices. Like, you should include in your diet the foods rich in folate, antioxidants like vitamin C, vitamin E, vitamin D, omega-3 fatty acids. And such foods we usually get from green leafy vegetables, fresh fruits, nuts, fish, whole grains. And any couple attempting to conceive, it is advised to consume or take folic acid supplements in a dose of 500 milligrams per day 3 months prior to planning their pregnancy through first 3 months of pregnancy. Apart from folic acid, it is also important to take vitamin D3 supplements as they tend to improve the egg and the sperm quality. So people tend to ask us, how should my pre-pregnancy diet be planned? So we can ask you to plan your diet in such a way that our diet major components are the carbohydrates, the proteins, and the fats. So the carbs are again of uh, complex and the refined types. Complex is from the fruits and vegetables that you take. So they cause slow rise in the blood sugar levels. Insulin levels will be maintained, and there won't be much of problem with such foods. But in case of refined carbohydrates, which are usually baked foods or the foods that are prepared out of maida, they cause a rapid rise in blood sugar levels. Insulin levels will shoot up accordingly, which will lead to increased risk of obesity and increases the risk of anovulation. And next comes to protein part, which is again of plant protein and animal protein. Plant protein is from the foods like soya, nuts, beans, and it is recommended to include at least 5% of these plant protein products in your everyday diet. And animal protein is again from the meat and the chicken. And coming to the fat, again, it is advised to cut down the products like biscuits, cakes, or anything that is prepared out of butter because they contain saturated fats. So always remember to consume food that is not processed, clean, balanced, and design your diet in such a way that 50% of your meal plate includes fresh fruits, vegetables, 25% with the whole wheat or brown rice or oatmeal, and another 25% with the proteins like the beans and the nuts. Never forget about the fiber rich foods like the almonds, chickpea. Take good amount of water, keep active, stay hydrated, and consume foods which are rich in sodium, potassium, vitamin D, which is all essential for the good egg quality. And apart from the diet, limit any consumption of sugar containing beverages and use healthy vegetable oils like olive oil or sunflower oil. And after the diet, the next important lifestyle practice is about the exercise, yoga. Exercise, it is recommended to have at least 30 minutes of moderate intensity exercise 3 to 4 times in a week, but never in excess again because it can again lead to anovulation. And exercise, apart from keeping you active, with also release some healthy substances called as endorphins, which will have a positive effect, like they cause uplift in the mood, and they are found to be beneficial. After the exercise, the point that has to be stressed is you have to keep your BMI in a normal range and maintain a healthy weight. So, what is BMI? BMI is nothing but body mass index, which is calculated uh, by the formula weight in kg upon height in meter square. And any BMI in the range of 18.5 to 24.9 is considered normal. And if it's less than 18.5, then you are underweight. And if it is more than 25, then you are overweight. Do these underweight and overweight, do they have any adverse effects on fertility? Definitely yes, because they tend to cause hormonal imbalance, because of which the egg is not released timely, and there is increased risk for anovulation. So it is important to keep your BMI within the normal range. If a obese woman gets pregnant, she is at increased risk to have miscarriages. There will be increased risk of hypertensive disorders in pregnancy, or she's more prone to have preterm labors. What happens in a men if they are obese? There will be decrease in the sperm parameters like decrease in the concentration, motility, and morphology. Apart from alteration in the sperm parameters, there will also be a change like decreased libido, and they tend to face erectile dysfunction. And last but not the least, the another important thing to do is to have at least 7 to 8 hours of sleep in a day. And now, after the do's, how to change the diet, how to maintain a healthy BMI, the exercise, the supplements that you're supposed to take. After that, what are the things that you need to avoid? What are the don'ts basically? So stop smoking, the most important factor for a female, because smoking tends to have its effects on the functionality of the tube. It'll increase the risk of ectopic pregnancies and decrease the fertility chance by around 40%. Apart from this, smoking also has its deleterious effects on uterine function, ovarian function, increases the risk of premature ovarian insufficiency. In a male, smoking will cause its effects on the sperm parameters like decrease in the sperm concentration, motility, and the morphology. Next don't is about limitation of the alcohol intake. And in a female, consumption of alcohol, in a study it was found that the time to pregnancy is increased in a female who consume alcohol. The next important thing is limitation of the caffeine intake to about 200 milligrams per day, or to maximum of 2 cups of coffee in a day. And coming to tea, same, it's again less than 3 cups in a day. Reduction of stress. Don't skip breakfast, the most important thing, and avoid junk foods because they also tend to cause anovulation. And the other important thing is you should limit the foods that are loaded with preservatives or sodium rich foods, and limit your salt intake, and limit the exposure to electromagnetic radiation, cell phone exposure. Apart from all these, the other caution these days is about this what is endocrine disrupting chemicals. These substances, they usually mimic natural hormones, and they are present in the products that we use in our day-to-day life, like in the toys that the kids play, or the milk that we consume, or in the processed foods. So it is recommended to limit exposure to endocrine disrupting chemicals. So always read the label before you consume any food that is purchased from outside. So after this discussion about how to optimize in terms of do's and don'ts, what to take, what to avoid, how to exercise, what about the sleep, caffeine, tea, and all. Now let's discuss about fertile window. So what is fertile window? Fertile window, it is a time during which we can say the conception chances are maximum in a woman who will have regular cycles, which is a 21 to 35 day cycle. So in such women, fertile window is usually calculated by using what is called as a menstrual or by maintaining a menstrual calendar. Such women, they tend to ovulate around day 16 of their menses, that is 14 days prior to the onset of next expected menses. So, couples attempting to conceive, they are advised to have alternate day intercourse during this fertile window. And this window is calculated by usually it lasts like somewhere around 5 days prior to and 1 day after the expected time of ovulation. So many people, they again ask us, how will I know that I am ovulating? So that can be known by simple observation that a woman can make, and there will be change in the character of the cervical mucus. And cervical mucus, it tends to become more slippery. There will be increase in the quantity of the mucosal vaginal discharge that she produces in between day 10 to day 14 of cycle. So intercourse during this period will increase her chance of getting pregnant. And the second method is to keep a track of basal body temperature. And post ovulation, the basal body temperature rises slightly because of the progesterone release. And the other method is by using the commercial urinary LH kits. So if you are able to see two lines in the kits, that implies that the ovulation is likely to happen within 48 hours. So in this way, you can track your ovulation, and intercourse, alternate day intercourse during this time period will also increase the chance of getting you pregnant. And the other question that people ask is about the usage of lubricants, which during the intercourse is not recommended, as the lubricants, they are likely to contain spermicidal agents which are likely to cause damage to the sperm. So to sum up, when do you need expert help, even if the practices that we have discussed so far, we are all following all the diet practices, we are all adapting to the do's and don'ts, and still the pregnancy doesn't happen, then is it that you will need any assistance? Is definitely yes. And also you need to seek expert help is when you will have irregular cycles, or there is some tubal disease, uterine disease, or you are told that you have something called as endometriosis, or if you're someone who's less than 35 and you have tried for complete 1 year of regular unprotected intercourse, still you are not able to conceive, or you're more than 35 and 6 months of regular unprotected intercourse, you're not able to get pregnant, you need to seek expert help. So if you're someone who had a previous abdominoperineal surgery, hernia surgery, or there was some malignant condition in the past and you had an exposure to radiotherapy or chemotherapy, then you need to start your fertility evaluation a bit earlier. Or your male partner experiences sexual dysfunction, or there is a known or suspected male subfertility like an undescended testis. In such scenarios, couple are advised to meet fertility specialist and seek their help. So couples are requested to get evaluated and start the fertility treatment without much delay in the above conditions that I discussed. So if you have any questions, you can type in the chat box and I'll try to help you out. So I can see a question: what factors can improve the fertility? So as discussed before, the do's like simple changes in the lifestyle, diet, maintaining a healthy BMI, good amount of exercise, 7 to 8 hours of sleep in a day, and the don'ts strictly stop smoking, limit alcohol, limit caffeine. Can These are the factors which can be done from your side basically to improve your chances. So the question is, what is the best egg size for pregnancy and how can I improve my egg quality? In terms of size, ovulation usually happens when the follicle measures somewhere above close to 18 to 20 millimeters. And whenever your folliculometry says that the follicle is somewhere close to 18 to 20 millimeters or anything above 16, keep having alternate day intercourse. So even frequent ejaculations will tend to improve the sperm quality as well and increase the chance for pregnancy. And regarding how can I improve my egg quality is by again a healthy lifestyle, vitamin D3 supplements, folic acid preconceptionally, good amount of protein rich diet, reduction of the stress is all the way to improve the egg quality. Symptoms of the other question is the what are the symptoms of fertile window? Fertile window, women can make simple changes or have some observation about the character of the cervical mucus. So if she can make out that the cervical mucus tend becoming more slippery and there will be increase in the amount of the discharge somewhere close to day 10 to day 14 of the cycle, increase in the mucosal vaginal discharge with its quantity, quality being noticed is one sign that you are likely that the ovulation is likely to happen in the next few days. Or if you are able to track your basal body temperature, there will be a slight rise, which is difficult to record, but still, because of the progesterone release, some women tend to feel there is rise in the basal body temperature, or by using the commercial urinary LH kits. So if you are able to see two lines on the kits, then it implies that within the next 48 hours, the ovulation is likely to happen. So the two lines implies that the LH surge has started and within 48 hours, the ovulation is likely to happen. So thank you one and all. If you have any questions.